Hi guys, it's Dr. Sadaf. So I wanted to tell you about an article that I read, and two of my friends and colleagues have published in this journal. This is called the OBGYN Green Journal, and we reference this. This is the main journal for the American College of OBGYNs, and I want to bring attention to this article that they published, and it's called the Postpartum and Lactation-Related Genitourinary Symptoms, and it's a systematic review. And the reason why it's important is because what it talks about. So here it is on page 59, okay? And two of the authors in this article are friends of mine, so I'm super lucky to have these friends that do a lot of research and publish these articles. Two of them are Dr. Jill Krapf and Dr. Rachel Rubin, and what they discovered, they coined a term called the Genitourinary Syndrome of Lactation. And what they noted was that when women are breastfeeding, right, what happens is that you have the hypothalamic pituitary axis, which is in the brain, which stimulates the ovaries to produce this estrogen and progesterone. But what happens when you're breastfeeding is that you have an increase in prolactin, which suppresses this hypothalamic pituitary axis, which suppresses the hormones that are produced by the ovaries, right? So we have a decrease in estrogen and progesterone. And what happens during that time? Well, one, a woman is able to breastfeed, but two, she starts to experience symptoms that are similar to that of menopause, which is she may have painful sex, decreased lubrication, may have some loss of elasticity in the vagina. And all of this is super important because a lot of times, before this terminology even came about, as OBGYNs, we would see this in our postpartum women, and in the back of our heads, we would think like, it probably has something to do with hormones, probably due to the decrease in the estrogen that is a result of the breastfeeding, right? But we never really put a terminology or a term to it. And now we have this term. It's called the Genitourinary Syndrome of Lactation. And that's why this article is super duper important. And so for all my colleagues out there that are OBGYNs, that have breastfeeding moms, that see breastfeeding moms, or women that are postpartum, that are lactating, really important to assess the vulva and ask them if they're having pain with sex. Are they having pain with lubrication, like they're not getting lubricated when they have intercourse? And if they've noticed that they're getting recurrent UTIs, because these all could be symptoms of decreased estrogen. And we know that the gold standard for decreased estrogen in the vulvar region is vaginal estrogen.